Well, those of you who watched the 4 o'clock show during the COVID pandemic may remember our extensive coverage during that time. We even added a half hour to our show for, I think, nearly a year. We counted on medical experts in the community to take time out from their very busy schedules to share information. And today, we're revisiting that with one of our most frequent dedicated guests, Infectious Disease Specialist from Memorial Health System, Dr. Nicholas Conger. Dr. Conger, I've missed you.
Yeah, it's been a while.
I don't miss those days, but I've missed you.
Yeah, definitely. Those were some difficult times for sure.
They were. I mean, it's kind of a blur looking back, isn't it? Because I know you especially, I mean, we all had so much more going on then, and you especially with dealing with the hospital and getting word out to the public.
Yeah, it was definitely some trying times, not just for me personally, but for, everyone was affected by that virus, whether they had loved ones who passed away or, the social changes really interrupted our lives and what we were doing. And so, I am glad that we seem to be through it at this point.
Did you expect at that point that it would we'd end up being relatively this far removed from it at this point? I mean, it's still out there, obviously.
Right.
I don't want to downplay that. But.
Yeah, it's still out there, but it's very mild. It has definitely gotten to be a much more mild virus. And when it first started, people said, it's not like the flu, it's much worse, and it was, especially during that Delta wave. But certainly, now it is mild, and I thought we would get there, but honestly, it took longer than I thought. I figured there would be this wave, people would get sick, and then we would rapidly go into a kind of a calm, seasonal, once or twice a year thing. But it took a lot longer than I thought for that to happen.
And I mean, you see a lot as an infectious disease specialist, but that has to be it for you. I mean, the biggest, of course.
Right.
No
yes.
doubt.
Yes.
And hopefully there won't be anything else like it in our lifetimes, but we never know.
Exactly. There's some scarier things you hear about, like hemorrhagic fevers, like Ebola and things like that. But that has never come to large population centers like this COVID did. So that definitely was the worst that I've been through, and I hope we never see anything like it again.
Oh, me too. And again, you were so great during those times we had you on all of these different Zooms. I mean, there were so many different times. Look, there you are with Dave Elliott. For a time there, we were on Zooms all the time, and then we had some distanced interviews, and those were some trying times for sure. There we are. That's how we usually were. You usually had a door behind you or something like that, and you were always so gracious, again, to do all of these interviews during such a busy time. Mm-hmm. And you were actually giving me some very positive news about Harrison County, how it's stacked up in recent years as far as COVID deaths.
Yes, definitely. There was a study published that ranked countyrankings.org, county health rankings, and it looked at death rates per 100,000 of the population, and it was for the year 2020, but it was amazing that the national average was 85, and Mississippi was higher than that. It was over 100, but
right, and that's 85 per 100,000, I believe,
100,000,
and 123
right.
In Mississippi for 100,000,
yeah.
But 59 deaths per 100,000 in Harrison County.
Right, that's right, and I think that just, and that's, so you were half as likely to have mortality from COVID if you were in Harrison County versus the rest of Mississippi. And I think that's a tribute to all the hard work, not just the doctors and nurses on the front line, but even the administration, rolling out the monoclonal antibody programs and things that we did, and
Sure.
trying to get the word out to the community and getting early diagnosis in the primary care clinics. I mean, so much went into that, but that's a good number.
Definitely tremendous teamwork during that time, and you were such a huge part of that. Dr. Nicholas Conger, thanks for joining us today from Memorial Health. I wanted to talk to you one more time. See, I'm going to get emotional. No, I'm not. It's too early for that. I have a whole nother week here.
Oh, that's great. Yeah. Well, you are welcome, and it's my pleasure, and I'm so honored that you had me back. So
Thank you. Thank you, Dr.